Thanksgiving is just a couple days away and more than a week after rolling out a broader mask mandate. Here's a look at COVID-19 in Iowa tonight. More than 216,000 people have tested positive overall. And while there have been nearly 120,000 recoveries, more than 2,200 Iowans have died from coronavirus. This morning, Governor Kim Reynolds acknowledged hospitalization rates appear to be stabilizing, but she says it's too soon to tell if the downward trend will continue, especially since the statewide positivity rate is the third highest in the nation.
Currently, younger adults age 18 to 29 account for most of the new positive cases, 20% overall, but cases do remain fairly evenly spread amongst most age groups.
As we wait for therapeutics and vaccines, the goal is to slow the spread so we don't stress our hospitals. Today, almost 200 doctors, nurses, and healthcare leaders released a joint statement calling on us Iowans to do our part. Many are struggling with staffing and bed shortages. Local 5's chief political correspondent Rachel Droz explains.
Iowa hospitals running out of healthcare workers, and some systems are hurting for space in the ICU.
Staff before we run out of beds.
This as COVID-19 cases in Iowa skyrocket, a combination that's stressing Iowa healthcare workers.
If these trends continue, physicians, nurses, and support staff will suffer additional stress and risk infection, illness, and death.
In Boone County, doctors starting to make difficult decisions to cancel certain elective and now necessary procedures.
Our hospitals having to make decisions not just on elective, but on more time-sensitive operations as well, based on the availability of ICU beds.
The Iowa Hospital Association starting to see a trend of hospital transfers as systems attempt to keep patient counts manageable.
As our smaller hospitals are needing to transfer patients to a higher level of care due to the patient's acuity level, we also have our larger hospitals now starting to transfer less acute, healthier patients down to the smaller hospitals to make room.
These doctors and healthcare workers say to help, all Iowans need to step up and do their part.
If we don't, as a community, rally around supporting our healthcare systems and attempting to minimize the spread, we could be in a dire situation over the next several weeks.
Rachel Droz, Local 5 News, We Are Iowa.
And you can help by fighting that COVID fatigue. That means continue following mitigation measures. Stay home when you can, wash your hands frequently, and wear a mask when you're out in public.